Cancer is a broad term used to describe a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. These cells have the potential to invade and destroy surrounding tissues and can also spread to other parts of the body through the bloodstream or lymphatic system, a process called metastasis. Causes. Cancer is caused by changes in the DNA within cells. These mutations can be inherited or acquired during a person's lifetime. Some common factors that can increase the risk of developing cancer include genetic factors. Certain gene mutations inherited from parents can increase the likelihood of developing specific types of cancer, such as breast, ovarian, or colorectal cancer. Environmental factors. Exposure to carcinogens, such as tobacco smoke, radiation, certain chemicals, and pollutants, can increase the risk of cancer. Lifestyle factors. Unhealthy habits, including smoking, excessive alcohol consumption, poor diet, obesity, and lack of physical activity, can contribute to the development of cancer. Age. The risk of cancer increases with age, as cells are more likely to accumulate mutations over time. Immunodeficiency. People with weakened immune systems, such as those with HIV, AIDS, or organ transplant recipients taking immunosuppressant drugs, have a higher risk of certain cancers. The symptoms of cancer can vary widely depending on the type and stage of cancer. Some general signs and symptoms. Persistent fatigue. Unexplained weight loss. Pain or discomfort that does not go away. Changes in the skin, such as darkening, yellowing, or redness. Changes in bowel or bladder habits. Persistent cough or hoarseness. Difficulty swallowing or persistent indigestion. Changes in a mole or wart. Unusual bleeding or discharge. It's important to note that many of these symptoms can be caused by conditions other than cancer. However, if any of these symptoms persist or cause concern, it is advisable to consult a healthcare professional for proper evaluation and diagnosis. There are numerous types of cancer, and each is classified based on the organ or tissue in which it originates. Top 13 common types of cancer. Liver cancer. Liver cancer, also known as hepatocellular carcinoma. HCC is a type of cancer that starts in the cells of the liver. It is the most common cancer worldwide and often occurs in individuals with underlying liver diseases such as cirrhosis, or chronic hepatitis B or C infection. There are two main types of liver cancer. Primary liver cancer. This refers to cancer that originates in the liver cells. Hepatocellular carcinoma is the most common type of primary liver cancer. Secondary liver cancer, also known as metastatic liver cancer. This occurs when cancer spreads to the liver from other parts of the body, such as the colon, lung, or breast. The cancer cells that have migrated to the liver are still considered to be the type of cancer from the original site. Symptoms of liver cancer may include abdominal pain or discomfort, unexplained weight loss, loss of appetite, yellowing of the skin and eyes, fatigue, weakness, nausea, and vomiting. 12th, thyroid cancer. Thyroid cancer is a type of cancer that originates in the cells of the thyroid gland, which is located in the front of the neck. The thyroid gland produces hormones that regulate metabolism and other important functions in the body. There are several types of thyroid cancer. 1. Papillary thyroid cancer. This is the most common type, accounting for about 80% of all thyroid cancer cases. It typically grows slowly and has a good prognosis. 2. Follicular thyroid cancer. This type accounts for approximately 10 to 15% of cases. It tends to spread to other parts of the body more often than papillary thyroid cancer. 3. Medullary thyroid cancer. Medullary thyroid cancer arises from the C cells of the thyroid gland and accounts for about 4% of thyroid cancer cases. It can be hereditary or sporadic. For anaplastic thyroid cancer, this is a rare but highly aggressive and fast-growing type of thyroid cancer. It tends to be difficult to treat and has a poorer prognosis. 5. Thyroid lymphoma. This is a rare form of thyroid cancer that originates in the lymphatic tissue of the thyroid gland. The symptoms of thyroid cancer can vary, but they may include a lump or nodule in the neck, hoarseness or voice changes, difficulty swallowing, enlarged lymph nodes in the neck, persistent cough, and changes in thyroid hormone levels. 11th, pancreatic cancer. Pancreatic cancer is a type of cancer that starts in the cells of the pancreas, an organ located behind the stomach. It is considered one of the most aggressive and deadly forms of cancer because it often progresses silently and is difficult to detect in its early stages. The pancreas plays a crucial role in producing enzymes for digestion and hormones, including insulin. There are two main types of pancreatic cancer. 1. Exocrine pancreatic cancer. This is the most common type, accounting for the majority of pancreatic cancer cases. It starts in the cells that line the ducts of the pancreas, which are responsible for producing digestive enzymes. 2. Endocrine pancreatic cancer, also known as pancreatic neuroendocrine tumors or islet cell tumors. These are less common but generally have a better prognosis. They originate in the hormone-producing cells of the pancreas and can be functional or non-functional. Symptoms of pancreatic cancer may include abdominal pain that radiates to the back, unexplained weight loss, loss of appetite, yellowing of the skin and eyes, changes in stool color, new-onset diabetes, fatigue, and digestive problems. 10th, leukemia. Leukemia is a type of cancer that affects the blood and bone marrow. It begins when the DNA of developing blood cells in the bone marrow is damaged, causing them to grow and divide uncontrollably. These abnormal cells, known as leukemia cells, crowd out healthy blood cells, leading to a range of symptoms and complications. There are several types of leukemia, some of them. 1. Acute lymphoblastic leukemia. This is the most common type of leukemia in children, but it can also affect adults. It progresses rapidly and requires immediate treatment. 2. Acute myeloid leukemia. This type of leukemia can occur in both children and adults. It involves the rapid growth of abnormal myeloid cells, which are responsible for producing red blood cells, white blood cells, and platelets. 3. Chronic lymphocytic leukemia, CLL, typically affects adults and progresses slowly. It involves the overgrowth of abnormal lymphocytes, a type of white blood cell. 4. Chronic myeloid leukemia, CML, is more common in adults and occurs due to the overgrowth of abnormal myeloid cells. It often progresses slowly at first but can accelerate over time. Symptoms of leukemia can vary but may include fatigue, frequent infections, fever, unexplained weight loss, easy bruising or bleeding, swollen lymph nodes, and bone or joint pain. 9th, endometrial cancer. Endometrial cancer, also known as uterine cancer, is a type of cancer that develops in the endometrium, the lining of the uterus. It is the most common type of cancer of the female reproductive system. The most common symptom of endometrial cancer is abnormal vaginal bleeding, especially after menopause or between menstrual periods. Other symptoms may include pelvic pain, pain during intercourse, and an abnormal or watery vaginal discharge. 8th, kidney cancer. Kidney cancer, also known as renal cell carcinoma, is a type of cancer that originates in the kidneys. The kidneys are vital organs responsible for filtering waste products from the blood and producing urine. The most common symptom of kidney cancer is blood in the urine, hematuria. Other symptoms may include a mass or lump in the abdomen, pain in the side or lower back, unintentional weight loss, fatigue, and intermittent fever. However, it's important to note that kidney cancer may not cause any noticeable symptoms in its early stages. 7th, non-Hodgkin lymphoma, NHL, is a group of cancers that originate in the lymphocytes, which are white blood cells that play a crucial role in the immune system. Unlike Hodgkin lymphoma, non-Hodgkin lymphoma refers to a diverse set of lymphomas that have different characteristics and behaviors. Symptoms of non-Hodgkin lymphoma can vary depending on the type, location, and stage of the disease. Common symptoms include swollen lymph nodes, fever, night sweats, unexplained weight loss, fatigue, and enlarged organs or masses in the abdomen, chest, or other parts of the body. 6th, bladder cancer. Bladder cancer is a type of cancer that begins in the cells of the bladder, which is the organ responsible for storing urine. It is more common in older adults, and it affects men more frequently than women. Symptoms of bladder cancer can include blood in the urine, hematuria, which is the most common and noticeable symptom. Other possible symptoms include frequent urination, pain or burning during urination, urgency to urinate, and lower back pain. It is important to note that these symptoms can also be caused by other conditions, but if any of these symptoms occur, it is essential to consult a healthcare professional for further evaluation. Fifth, melanoma. Melanoma is a type of skin cancer that develops in the cells called melanocytes, which are responsible for producing the pigment melanin that gives color to the skin, hair, and eyes. Melanoma is considered the most dangerous form of skin cancer because it can spread to other parts of the body if not detected and treated early. It's important to be aware of the ABCDE rule to identify potential signs of melanoma. A. Asymmetry. One half of the mole or growth does not match the other half. B. Border irregularity. The edges of the mole are irregular, blurred, or notched. C. Color variation. The mole exhibits uneven color, with shades of black, brown, tan, white, red, or blue. D. Diameter. The size of the mole is larger than 6 mm, about the size of a pencil eraser, although melanomas can be smaller. E. Evolution. Any changes in the size, shape, color, or elevation of a mole or the appearance of a new mole should be monitored. Fourth, colorectal cancer. Colorectal cancer, also known as colon cancer or rectal cancer, is a type of cancer that affects the colon or rectum, which are parts of the large intestine. Colorectal cancer typically begins as a growth called a polyp on the inner lining of the colon or rectum. While most polyps are benign, some can develop into cancer over time. Symptoms of colorectal cancer may include changes in bowel habits, such as persistent diarrhea or constipation, rectal bleeding or blood in the stool, abdominal discomfort or cramping, unexplained weight loss, and fatigue. However, it's important to note that early-stage colorectal cancer may not cause noticeable symptoms. Third, prostate cancer. Prostate cancer is a type of cancer that develops in the prostate gland, which is a small walnut-shaped gland located below the bladder in men. The prostate gland produces seminal fluid, which helps nourish and transport sperm. Prostate cancer is one of the most common types of cancer in men. It usually grows slowly and may not cause any symptoms in the early stages. However, as the cancer progresses, it can cause symptoms such as frequent urination, difficulty in starting and stopping urination, weak urine flow, blood in the urine or semen, erectile dysfunction, pain or discomfort in the pelvic area, and bone pain. Second, lung cancer. Lung cancer is a type of cancer that starts in the cells of the lungs. It is the leading cause of cancer-related deaths worldwide for both men and women. Lung cancer is commonly associated with smoking, but it can also affect non-smokers due to other factors such as exposure to secondhand smoke, environmental pollutants, or genetic predisposition. Types of lung cancer. There are two primary types of lung cancer. 1. Non-small cell lung cancer, NSCLC. This is the most common type, accounting for about 80 to 85% of lung cancer cases. NSCLC includes subtypes such as adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. 2. Small cell lung cancer, SCLC. This type is less common, accounting for about 10 to 15% of lung cancer cases. SCLC tends to grow more quickly and is often associated with a history of smoking. Symptoms. Lung cancer may not cause noticeable symptoms in the early stages. As the disease progresses, common symptoms can include persistent cough, often with blood, chest pain or discomfort, shortness of breath, wheezing, hoarseness, fatigue and unexplained weight loss, recurrent lung infections such as bronchitis or pneumonia, loss of appetite. It is important to note that these symptoms can also be caused by conditions other than lung cancer. However, if any of these symptoms persist or cause concern, it is advisable to consult a healthcare professional for proper evaluation and diagnosis. First, breast cancer. Breast cancer is a type of cancer that forms in the cells of the breasts. It is the most common cancer among women worldwide and can also affect men, although it is much less common in males. Breast cancer typically originates in the milk-producing glands, lobules, or the ducts that carry milk to the nipples. Symptoms. The symptoms of breast cancer can vary, but common signs to watch for include a lump or thickening in the breast or underarm area, Changes in breast size, shape, or appearance. Nipple changes, such as inverted nipples, nipple discharge, or redness. Dimpling or puckering of the breast skin. Breast pain or tenderness. Swollen lymph nodes in the armpit. It's important to note that not all lumps or changes in the breast indicate cancer, as many benign, non-cancerous conditions can cause similar symptoms. However, if you notice any unusual changes, it's best to consult a healthcare professional for further evaluation. Cancer diagnosis and treatment. The diagnosis of cancer typically involves a combination of medical history assessment, physical examination, imaging tests, such as X-rays, CT scans, MRIs, laboratory tests, including blood tests and biopsies, and sometimes genetic testing. Treatment options for cancer depend on various factors, including the type and stage of cancer, its location, and the overall health of the patient. Common treatment modalities include surgery. Surgical procedures are used to remove tumors and surrounding tissues. Radiation therapy. High-energy radiation is targeted at cancer cells to kill them or prevent their growth. Chemotherapy. Medications are used to destroy cancer cells or stop their ability to divide and multiply. Immunotherapy. This treatment activates the body's immune system to recognize and destroy cancer cells. Targeted therapy. Drugs specifically designed to target and block the growth of cancer cells based on their genetic characteristics. Hormone therapy, used for hormone-related cancers to block or interfere with hormones that promote cancer growth. Stem cell transplant, a procedure that replaces damaged bone marrow with healthy stem cells to restore the body's ability to produce blood cells after high-dose chemotherapy or radiation. The treatment plan is individualized for each patient, and often a combination of these approaches is used. Supportive care, including pain management, nutrition support, and psychological support, is also an integral part of cancer treatment. Regular follow-up appointments, monitoring, and screening are essential to assess the response to treatment, detect any recurrence or new cancer, and manage potential side effects. Additionally, lifestyle changes such as maintaining a healthy diet, exercising regularly, avoiding tobacco and excessive alcohol consumption, and protecting oneself from excessive sun exposure can help reduce the risk of developing cancer.